For decades, we really haven't worried very much about gonorrhea, the sexually transmitted disease. Hundreds of thousands of people a year still get it, actually millions and millions around the world. But it was easily treatable. You catch it early, it's no problem. But lately there has been a change, and Dr. Ahluwalia is with us for this thing. And this is disturbing because the disease is ahead of your ability to treat it at this point.
Absolutely. You know, about 700,000 new cases come up in the United States. That's what the CDC thinks. And, you know, in the good old days, penicillin was the cure. You gave penicillin to cure of it, right?
Yeah.
The problem is that, you know, if you thought of gonorrhea as a person, it's a really wily person. So it keeps adjusting to the antibiotics that we throw at it. And, you know, as we've discussed this in the past, we overuse our antibiotics. So that's why we are contributing.
Meaning they're overprescribed.
Yeah, not only that, but I think a lot of people are ashamed to go to their doctor, so they just take the medicines themselves, and they partially treat it or expose it to not enough antibiotics to kill it. So what's important is, you know, we had 2 antibiotics that were working on it. Now we're down to 1. So this is the latest. The last but one has stopped working, so now we only have 1.
And this could stop working too.
Yes, potentially. And the interesting thing is that this is a shot. This is not a pill. So you need to go to your doctor, you need to get the shot, and combine it with other pills to make sure you get rid of the antibiotic.
Is this a trend we're going to start seeing with other diseases, that we can't treat them anymore because we're becoming immune to the antibiotics?
Well, they're becoming immune to the antibiotics because what's happening is that we're giving them partial treatment, more and more. And as a result of that, they're becoming immune to it.
You know, as an analogy, we talk about performance-enhancing drugs in sports, and every time there's a test that can determine it, they learn a new way to beat the test. It's almost the way that this works.
Yeah, it's like a person, right? Yeah, we're trying to avoid whatever it is.
And nature is smarter than we can be.
Nature is always smarter. But here's the interesting thing is, make sure that if you're diagnosed with this infection, treat your partner or partners. And safe sex is always the best.
Is there a time frame on that in terms of partners?
Well, usually the disease manifests within a week or 2, right? But the interesting thing is that women who have gonorrhea, 50% of them have no symptoms. So they could be harboring this bacteria for years and not know it. So unless a man gets infected and goes to her and says, look, I have this infection, you need to get treated, she won't know.
On to another topic here, and that is the use of statins to battle cholesterol and heart disease. And I don't know what, $50 billion is spent every year on statins in this country.
We have like 20 million people on statins.
It seems like everyone is on something like that.
And you know, what's interesting is no medicine, and we've talked about this, is without side effects.
There's no free rides in medicine.
So everything has a benefit and everything has a downside. And the latest what we found is that some of these statins can cause some people to have diabetes. That's the latest. Now the interesting thing is not everybody gets diabetes, right?
So who would be at risk?
So people who have predisposition to diabetes, either they're overweight, right? But we typically think of people who are obese to develop type 2 diabetes. It's not necessary. If people just have fat around the belly, this is a metabolic active fat, and that can cause diabetes by itself. So people who are obese, people who we think maybe postmenopausal women are more susceptible to this. You know, I think that as you get older, you're more likely, as you have pre-diabetes. So some people have higher levels, as we talked about, and those people are more susceptible. So these are people who need to watch out, because they may develop diabetes with statins.
Always the question I ask you, you're the doctor. How do you make the determination? There's an art here, not a science.
You're always thinking about risk versus reward.
So I don't think, and here's what's most important. Even though it can cause diabetes, the people who are diabetic still need to have their heart disease under control, right? They're more at risk to develop heart disease, so they still need that protection. So I think we need to be cognizant of the fact, but I think we don't want to stop the statins because
cardiovascular
for every
disease,
one person who develops diabetes, about 3 times as many get saved from heart disease or stroke.
Okay, a quick question before you go. Woman is watching the show now. She says, I'm postmenopausal and I have a little fat around my tummy. What does this mean to me?
So I think this is something that you need to be cognizant of and ask your doctor when you go in, because
now she's scared.
Well, there's nothing to be scared about, but I think it's important to be advised and have knowledge, because knowledge is power. In this case, it's not just 2 things. There are multiple factors which contribute to that.
Just to be aware of it and monitor it.
Exactly.
That's kind of the main thing.
Absolutely.
Dr. Ahluwalia, thank you very much.